Welcome back to the Morning Blend. Venous disease is more than just a cosmetic problem. It can be painful and it can be dangerous, especially if not treated. Joining us now is Dr. Deborah Manjoney for the Wisconsin Vein Center MediSpa to explain this problem and go over some possible treatments or solutions. Nice to have you on the show this morning.
Thank you very much.
Let's talk about first how many people suffer with venous disease. Are there some estimates?
It's amazing that in this country it's estimated that probably 80 million people have some form of venous problems. And that ranges from spider veins on the less severe end that are not related to any other problems to deep vein problems, the veins that are very important for emptying your legs underneath your muscles where clots can cause complications such as pulmonary embolism and death, to problems with varicose veins, and varicose veins can have very significant complications, and varicose veins are a problem usually in the superficial veins.
Okay, and when you say superficial veins, that doesn't necessarily mean that it's just cosmetic. It still can be a serious problem,
yes,
right?
Yes, it can.
Okay.
There are two sets of veins in the legs, the veins that are underneath the muscles called the deep veins, and they're the more important veins in the legs, and they do the most work of emptying the legs of the used blood to go back to the heart and lungs to get recirculated.
Okay.
And then the superficial vein system, which parallels it but is on top of the muscle, so it's underneath the fat layer in your legs, and those usually are only collecting veins that only carry about 10% of the blood return back to the heart and lungs, but when they're not working, blood pools in them because of gravity.
You brought some pictures.
Yes.
The one demonstrates the difference between a normal vein and this is an illustration, and a varicose vein.
That's
so what's the difference there as we look at that?
So most veins in the legs, certainly all veins, have little valves in them. They're little leaflets that open to let the blood go up and close to prevent blood from being pulled back down by gravity forces.
Okay.
And so in a normally functioning vein, those valves are working properly and the blood is going upward back toward the heart and lungs. In an abnormally functioning vein, what happens is those little valve leaflets fail for a number of different reasons. Usually there's a hereditary predisposition, and then lifestyle issues may play a role in accelerating the process and having valve leaflet destruction or just the vein leaflets pulling apart because the vein gets over distended.
Okay. The next picture is kind of the anatomy of the vein.
Right. And so here in the superficial veins in the legs, we see that the vein parallels the bone, and so it's going in an upward direction, but you can have branches that become very elongated and tortuous, or really zigzagged and kinked.
Okay.
And that's because they're overfilled with blood because the valves aren't working. And what happens is, in order to accommodate the extra blood that's in these veins, the vein starts to elongate because it can't stretch any further.
And then does it sort of bulge?
Yes, and then it starts to bulge underneath the skin because these aren't under the muscles, these are just under the skin and soft tissue, and there's no support structure to prevent them from bulging out on the surface.
Now, as we look at before and after pictures, and we notice some of that bulging that you're talking about on the left, for example,
yes.
Are those superficial veins
They're
that we're
all
seeing?
superficial veins.
Okay,
yes.
so there could be a problem underneath, but there's obviously also a problem in
but most superficial vein problems, most varicose veins, are caused from a problem in the superficial vein trunks. There are the two trunks that go parallel to the bones.
Okay.
Because these don't necessarily do that, are the great saphenous vein and the small saphenous vein. And they're not deep veins, but you don't necessarily see them on the surface because they are contained more within a muscle layer, a fat layer or sheath. So the muscle, so the fat prevents the veins from bulging out.
It's amazing to me as I look at these. I know that it's a serious health problem, but from a cosmetic standpoint, the improvement in the before and after, you can't go without saying how dramatic that is.
It is definitely dramatic. It's frequently incapacitating for women to have these kinds of issues because they certainly don't want to expose their legs at all. But in addition, what can happen is when you have veins that are backed up like that, the leg gets congested, it's overfilled with blood, and so the skin can become swollen and actually leathery, and then you can have severe complications such as a breakdown of the tissue that doesn't heal because the skin's not allowing blood to be drained, and you get ulceration that can last a long time. Veins that are like that are close to the surface that are not having the normal blood flow in as rapid a fashion as possible can also be prone to blood clots and superficial phlebitis, which can be very, very painful.
So what are the treatment options?
There are so many treatment options now that are done in our office that are minimally invasive and allow people to get back to work immediately. So everything that we do is done under local anesthesia. We use different laser techniques to actually close a trunk vein if that's abnormal. We do removal of veins. It's not a true stripping because we're doing it through little tiny needle punctures. So no sutures are needed. We just bandage afterward, put somebody in elastic compression injection stocking, and they can get back to normal activities immediately.
That's amazing. And do people usually need more than one treatment?
Depends on what they have.
Okay.
And so we start with a diagnostic procedure, an ultrasound, to show us what's going on in the leg. It gives us a roadmap. And then from there, we have a discussion, and I make some recommendations to people about what kind of treatment they need. But virtually everything can be done in the office for vein problems.
And what's exciting about it is that you can potentially prevent a really serious health problem, as well as dramatically improve the appearance of someone's veins, particularly in the legs. So here's the information for the Wisconsin Vein Center and MediSpa. Don't let this problem go. Make sure that you're seen, especially because some of the treatments are minimally invasive and you can get back to your routine quickly. They're located in Pewaukee on Georgetown Drive. The phone number is 262-746-9088 or go to wimedispa.com. Important information for Health Week. Thank you so much.
Thank you.